name is Ankita Talukdar, and today I'll be demonstrating a buried suture for my project of clinical specialty and my career choice of plastic surgery. To start off with, I've already washed both hands thoroughly and put on sterile gloves. Next, you're going to want to take out your necessary instruments, such as cut imitation skin, tissue forceps, a needle holder, and suture thread with an attached needle, which I've already removed. Then you're going to pick up your tissue forceps with your left hand and pick up your needle holder with your right hand. Using the needle holder, place the needle attached to the thread in between the scissoring of the needle holder and making sure that your needle holder and your curvature is facing upwards. Now using the tissue forceps, you're going to want to insert and pull the skin far apart to view the deep dermis, which is this white fatty layer. And you're going to insert the needle on the left side of the vertical laceration into the deep dermis, like so. And you're going to want to pass the needle from the deep dermis and exit into the superficial dermis, which is this top layer right here, so that it is parallel to the insertion point. I'm going to pull the needle through, leaving a couple centimeters of thread so that I'm able to tie a knot at the end to close the laceration. Next, you're going to want to either use your hands or the needle holder to ensure that the curve faces downwards on the needle. And you're going to cross the needle from the left side to the right side of the laceration and insert parallel to the original insertion point, which is right here, into the superficial dermis this time, and exiting from the deep dermis, which is this white fatty layer in between. And I'm going to exit through this deep dermis and pull the needle. And you want to make sure that this loop here, shown above here, is directly on the same side of the curvature. So you want to make sure both of the sides are on the same, otherwise the suture won't be buried. And you want to pull tight so that this thread here is super tight. And you're going to want to put your tissue forceps down in a safe place and your needle holder down in a safe place. And you want to put your curvature off to the side. Now this is the time that we're going to tie the suture. So in order to tie it, we're going to pick up our tissue forceps and we're going to grab this thread that is connected to the needle curvature and wrap it around twice with our tissue forceps and use the remaining thread from the first insertion and pull it through those double holes that we created and tie it directly vertical to the laceration. And you're going to repeat this 3 times so that the knot is tight and will not come undone. Basically, a buried suture is used in plastic surgery because it is inside of the skin and there is minimal scarring, which is why plastic surgeons typically use this for cosmetic procedures, as it will not be viewed as harshly. And since I've tied this knot 3 times, I'm going to cut off our excess thread. I'm going to pick up the needle holder and I'm going to grab the 2 sides and cut off the excess thread, leaving a couple millimeters of thread behind just so I can see the stitch. Now, since I've cut it off, you can see the black ends poking out, but the stitch itself is inside the deep dermis. And this is how you do a buried suture. Thank you.